everyone, it's Coach Rick. So hopefully you're all doing well during this COVID Thanksgiving and Christmas and Hanukkah and New Year's. Please stay safe, mask up, wash hands, keep distance, try not to travel. But what you can do, in addition to all that other stuff to keep yourself healthy, is exercise. Exercise, nutrition, mindful practice, and really decent sleep. All those things are important. Take it easy with the alcohol, because I think it lowers the immune system. But if you don't do any of that stuff, please get a coach, one of my coaches, to guide you as far as how to introduce, how to maintain, and how to crank it up. Always need to be challenging your routine. Now, those of you who do exercise, cool, maintain. But what I wanted to talk about today is using a weight belt. So this is my weight belt, and I'm really, I use it when I'm going heavy. And I think my core is pretty decent. Well, coming off of this COVID infection, core sucks because I haven't exercised. Why? Because I did not want to turn on or add to the cytokine storm. And immunity does respond, as I mentioned to you, but I think in some cases, especially with the type of exercise I do, it can certainly bring on inflammation. So I am now about a week past the COVID. And today or tomorrow, Saturday or Sunday, I'm going to start reintroducing exercise. So exercise maintenance is important. So what we're going to talk about is why you should use a belt. So I have put together a couple of bullet points about how to use a belt. I used to use a 6-inch belt. That's a 4-inch belt. 4 inches is just the thickness of the belt. I used to use a 6-inch belt. The idea about why you should use a belt, it's because you want the core, your core, to be strong. The core is made up of a box. I'll get to that in a second, but let's just talk about why you use a belt to strengthen. Most people usually have a weak core. I think most of my boxers, my athletes that transfer kinetic energy from toe to hand, that's a kinetic chain, they know the value of core. My hikers know the value of core. After a couple hours, if you have poor core, you're going to be in pain, and you have to have core. So coelom is a biological term. It refers to an empty or hollow space, like your abs. And it's empty for a couple reasons. It's supposed to help the cushioning, the internal organs. There's a lot of vital organs in here. And it's empty because if you stop suddenly, like a car, the organs can be cushioned. There's something called an apron in here. It's a fat apron. Some people have a huge apron, especially like beer drinkers. Some people have just a small apron, but the apron is a living thing that also helps to cushion the internal organs. A lot of valuable stuff here. So it works to cushion. That's why we have this empty space. It also helps with mobility. Mobility meaning if you eat a lot of food, the small intestine and large intestine have to move a little bit. They have to expand a little bit. So you have to have a space here that allows for expansion and contraction. And say after Thanksgiving, please try not to eat too much, but after Thanksgiving, usually you're bloated and full. That's because the stomach is full and then the small intestine's getting the contents of the stomach dumped in and you're really distended. And that's obviously not the best time to do a deadlift, but it allows movement. That's that hollow coelom or the cavity. In fact, third is that it decreases mass. So if you had nothing but solid, not that your chest is solid. I mean, this is hollow too. It's the lungs. This is hollow. It's the abdominal cavity. But this is solid. Legs are solid. Glutes are solid. So the solid mass adds weight. If you had this being all solid, I mean, we would weigh 1,000 pounds. So that's another reason for the coelom. So hopefully I'm not losing you with regards to why you have to have this empty core. But think of it this way. This is one of my peanut speed bags. Kind of tiny. The tinier the speed bag, the faster it moves. So you can see that it's kind of soft. And what good is a ball when it's soft? It doesn't do anything. If you try to hit this, it'll not bounce. Now my bigger speed bag, this is the one I start out with. I can even hold this here and it'll give you a good bounce. It gives good resiliency. versus an underinflated core. If you play basketball with a deflated basketball, it'll stay on the ground. If you drive your car with a deflated tire, it's not going to roll. So it's important to have the contents of the coelom protected and cushioned, but it's also important to have the coelom nice and taut. So if the coelom is taut, if this empty space is taut, you can transfer, here's the clincher, you can transfer energy from the lower extremity to the upper body. So when the coelom is not taut and it's flabby, then all that work, even great legs, cannot be transferred up into the upper body. So a deadlift typically transfers the power of the legs into the upper body. If your core sucks, then you can't transfer and something's going to give here, and that's an injury. So that's why it's important to develop a core, and if you're just developing your core, it is okay to use a belt. So the belt will give you a little bit of a taut surface. So let's talk about the basics of a coelom or core. Core is made up of a box. Think of it that way. You got the front of the box, the abs. You got the side of the box, the obliques. You got the back of the box, the lumbar erectors. You got the top of the box, the diaphragm, and you have the bottom of the box, the pelvis. So if the sides of the box are strong, then as long as you can hold breath and maintain it and the box is intact, you can transfer power really fast. You can also transfer power downward too, which is cool, especially if you're a sprinter or if you're trying to take a hill in hiking. So that's why it's really important to have development of core. And going back to what I talked about in the beginning, if your core has a weak spot, which typically it does for a lot of my average Americans and my moms who just gave birth, then this will give you somewhat of a protective surface to strengthen the core up while you work on developing your core. So let me explain that. The muscles that make up the box, diaphragm, pelvis, obliques, lumbar erector, the abdominals, they all work to give you strength, power, and explosiveness and endurance. So if the muscles are fine-tuned, you should be able to do anything you want. Certainly distance runners, if they have bad core, it's because they're not going to be able to do the distance. Hikers, if you have a bad core, you won't be able to carry the packs. Golfers, if you have a bad core, you won't be able to swing aggressively. So martial artists, when they do spinning back kick, same thing. Boxers, when they try to connect and use the stability of the lower extremity and say in an uppercut, if your core sucks, you won't be able to transfer that strength, that power, the energy. So that's why it's important to have a core. I promised one of my international clients that I'd talk to her about core. So I'll be doing, after I'm done for the next couple of weeks as I'm recovering from COVID. Well, actually I'm recovered from COVID, but I'm going to start cranking on abdominal work, and I'll show you on Facebook some of my ab workout. So here's the problem. So we talked about coelom, we talked about core. Now we're going to talk about staying sealed. Sorry, I had to put SC. Anyway, so you keep the box sealed by having good strength. The only problem is if, as I mentioned to you before with moms, when that belly comes out for 9 months, you can have something called Diastasis Recti. And you moms know what I'm talking about. But some of my guys that have big bellies will know what I'm talking about too. If I tell you that you have a little bit, in fact, you can do it yourself. If you're gonna sit down, as long as you're not in pain or have a back problem, lie down on the ground and then do a little bit of a lift up. And you'll see it. If you have this little bubble here, that's a ventral hernia. A lot of my guys don't even know, and I just say, lift your feet off the table when they're lying flat. And you see this little bubble pop up. That's the that's a rectus abdominis separating. So, sorry, I have to get into anatomy. So the rectus abdominis goes from the bottom of the ribs, the xiphoid, and along the front, and inserts into the symphysis pubis. So those two bone anchors, and then these two straps of muscle. That's what you see as far as a six-pack. And sometimes, not sometimes, you're supposed to have the two edges melded or welded together. And if you do, then when you get the six-pack strong and you have no fat, you'll be able to see the ripples. But as you get older and as you have a baby and as you gain weight, sometimes because of atrophy, that rectus abdominis separates. And then you have the bubble come through. That's the ventral hernia for my it's for my overweight guys or under exercised guys. Or it's the diastasis recti that comes out with having delivered your child. Now, I really think, depending on how bad it is, I think you can develop it again. So if you're in pain, if you have bad back, if you have discs, then it might be a problem. It's going to be a challenge if you have a bulging disc, pinched nerve, herniated disc. That'll be a challenge. But I do think that if you can control the back and the pain and the strength and develop the abs, you should be able to strengthen, get endurance, and keep up mobility to the abdominals so that you get those things thicker, the rectus abdominis thicker, and hopefully with thickness you'll see it approximate better. And I think you'll see the ventral hernia go away. Diastasis recti, sometimes you have to have a surgeon put it together, but we'll have to see. I would always say try conservative treatment first. So that was one thing. There's other things that also add to weakness of the box. Hernia, if you have a hernia in the groin or that ventral hernia I talked about. Reflux. So the diaphragm is supposed to be strong, and if you have terrible reflux, that means the hole that penetrates through the diaphragm, the esophagus that goes into the stomach. If the reflux is there, that means the hole is open, and that could force, it won't force your stomach up, theoretically, but if you're trying to hold your breath with a Valsalva maneuver, put your weight belt on, do a heavy lift, sometimes your stomach contents will come up and you'll have acid. That's why people who bend over when they have reflux, all the food comes up, or if they're trying to squat, they get acid tasting because their reflux is bad. So I have another video on reflux, but there's also incontinence. So sometimes incontinence, if you have weakness to the pelvis and you try to do a heavy squat, you'll fart or you'll have a little pee come out. That means you have to develop the pelvis. So you need to see a pelvic therapist for that, because there are physical therapists that are trained specifically for strengthening the pelvis, guys or girls. Patient-wise, I'd say seek out a pelvic therapist, especially if you had passed a 8-pound bowling ball through your vagina. So it's important to have a coach develop the pelvis for you if you're not sure what to do. The Kegel exercises are so archaic. I think that you have to have specifics on range of motion of the hips, pelvic strength. You have to have a talk about bowel function and sex. So it's important to have a pelvic therapist. So you take care of the hernia up here, you take care of the reflux, you take care of the diastasis recti if it's that bad, you take care of the incontinence and the weakness of the pelvis. Last but not least, we have bloat. I did put bloat there because some people, when they have back problems, they'll notice a really bad flare-up of their back problems when they're bloated, because once you eat a big meal like a Thanksgiving meal and you're bloated, you lose the strength. When you stretch out the abs, you lose the strength of the front. And if you lose the strength of the front, or you're always walking around like that, like the guy on the Beatles' Yellow Submarine, you have to load the back up with extra pressure and work. And if the back is already failing and you tell it, now I gotta do more work, that's not good. So it's important to not get bloated. Thanksgiving, just pace yourself. So my IBS people, you definitely want to take care of the IBS, and I have another video for that too. So bottom line is that I do think that a belt is helpful. One more thing. I've seen videos online where some of these guys, these young guys, are cranking the belt, like take a deep breath, pull the straps, and then no. You want this strong, you want this firm, but you don't want it to wipe out your drive, your abdominal drive. You're supposed to breathe with your abdomen and not your shoulders. So it's important to have a little bit of, it should be stiff. And I'd say getting a thumb in here should be good, but watch it, because if you make it too tight, you won't be able to have abdominal breathing. You might pass out. If you have it too loose, there's no feedback, muscle feedback, which I guess I'll close with that. If anything, the belt like in working at a warehouse, the belt does give you a sense of awareness, gives you a sense of I have to keep posture, and that's what that 6-inch belt was good for. It would help me keep posture when I was doing a deadlift. So, because it was so big and stiff, but sometimes they're a little bit too big, and it's hard to find a 6-inch. Now, the old-fashioned leather belts versus the Velcro ones, doesn't matter. I think that if you're doing Olympic lifting or power lifting, you might want to get leather. It's cooler, I think. Cushioning versus no cushioning, don't worry about the cushioning. That is something to consider because it does get sweaty. The bigger the belt, it does get sweaty, but you're going to be exercising. So now if you're using a belt for endurance and work, that's a little bit different. I usually see the Home Depot guys walk around with the belt undone. It's probably okay as long as you remember to put it back together when you're doing any lifting. So hopefully this gives you a couple of ideas of why you should be using a belt, why you should be working on core, and don't throw in the towel. I'll give you some exercises in the next couple of days to weeks. But even if you have all this stuff, there's still ways to fix it. Worst case scenario, you see a surgeon and he fixes it. So I have some really good surgeons that do a hernia repair using scope. Usually when you have abdominal surgery like an appendix out or a gallbladder out, even if it's the small ports, my surgeons usually do not allow soccer players post-hernia to continue or to kick and exercise until 2 months after healing because you have a weakened area. So if you have a weakened area and you increase Valsalva maneuver, you're going to force pressure in that box through the weakest spot. And if the weakest spot is the suture line, you're going to blow the sutures. If the weakest spot is a low pelvis or a reflux issue, you're going to have incontinence, poop, pee, and or reflux. If the weakest spot is a back, that's a disc that's protruding, you're going to force that disc out. So please be careful. This is not meant to be medical advice. Go ask your doctor. If your doctor doesn't help you, get a new doctor. So hopefully this gives you a little bit of an idea what to do. Don't forget to check out my channel on YouTube and subscribe and hit the alert button. Otherwise, I'll see you at the next video.